Pfizer's coronavirus vaccine is showing 92% effectiveness in Israel, according to the world's first big controlled investigation on how it works outside of clinical tests. Only 31 out of 163,000 Israelis vaccinated by Maccabi Healthcare Services were diagnosed with COVID-19 in their first 10 days of full-strength protection, its top vaccine statistics analyst, Anat Eka-Zohar, told the Times of Israel on Thursday. Maccabi found that an equivalent sample of unvaccinated Israelis was 11 times more likely to be diagnosed with the coronavirus, which allowed it to calculate the effectiveness rate. This is very, very good news, Eka-Zohar said. It is the first study in the world that looks at such a large number of fully vaccinated patients. Pfizer achieved 95% efficacy in clinical trials, and doctors worldwide are looking to Israel with bated breath to see whether the vaccine comes close to that figure in real-world use. Professor Eyal Leshem, infectious diseases specialist at Sheba Medical Center, told the Times of Israel that people should be excited by the strong result, and not concerned by the 3% shortfall. This is a very high figure, well within the standard deviation we would expect, said Leshem. Maccabi figures released earlier this week indicated that vaccination is working very well, but lacked a control group that made it hard to extract an accurate effectiveness rate. Now, Maccabi has analyzed a control group of Israelis with similar age and health profiles of vaccinees, composed entirely of people who haven't been infected or received shots. This allowed Maccabi to calculate its real-world effectiveness rate. It used complex calculations, similar to those used by Pfizer in trials, to compare vaccines and the control group and determine the extent to which the vaccine appears to be preventing infection. This is very exciting, said Eka-Zohar. It's a very high level of effectiveness and we are seeing a very low percentage of coronavirus among the patients who have taken both shots. Full protection is believed to kick in a week after the second shot, so Maccabi's data covers all of its members who are between 7 and 16 days after receiving it. Eka-Zohar said she was encouraged by the light symptoms of vaccinated people who caught the coronavirus, as well as by the low infection rates. None have been hospitalized and they have very, very light symptoms, she stated. We are talking about headache and a mild feeling of sickness, and they are almost completely without fever. It's really a very light illness. Israel's other health provider have yet to present data with a control group, meaning that while the health ministry released data on the whole nation on Thursday, it didn't help build a picture of effectiveness levels. The health ministry reported that there have been 317 infections among 715,425 vaccinees, a rate of 0.044%, or about double the infection rate seen among Maccabi members. However, Maccabi members tend to come from a higher socioeconomic background and live in areas with low infection levels. Eka-Zohar said that if there were a national control group, it would likely indicate a similar effectiveness level to Maccabi's data. This article was originally written by Nathan Jeffay for the Times of Israel on January 28, 2021. Vaccine drive slowed by 50%, official laments, blaming online fake news. Even though vaccines are now being offered to all Israelis over the age of 16, the pace of inoculations has slowed dramatically, a senior official in the country's largest health provider said, accusing online fake news of promoting vaccine skepticism. At the beginning of the vaccination campaign we got used to inoculating between 100,000 and 120,000 people per day, and in the last few days we are barely reaching half of those figures, Kalanit K., the manager of Klalit's vaccination drive, told the Init news site. We are prepared, our centers are big and accessible, the process should be pretty simple on the whole, vaccines are being given for free, so I don't understand the people who don't come to get the shot. It's a big mistake, she lamented. Israel's vaccination program with the Pfizer-BioNTech shot is ongoing, with 3,426,810 people having received the first dose as of Sunday. Of those, 2,016,351 had also received the second dose. There was greater cooperation among the at-risk populations, Kay added. Right now we're reaching out to the younger public, and some people don't understand the vaccine's importance. Unfortunately, the fake news on social media and in the press is doing damage. People aren't sufficiently afraid of the coronavirus because they aren't familiar with what it causes. According to Health Ministry data released Sunday, 92.8% of those 60 and over either received the first vaccine dose or had been infected and recovered from COVID-19. Some 69% of those 60 and over received the second dose more than a week ago, effectively making them immune to the virus. During a meeting Sunday of the Knesset's Constitution, Law and Justice Committee, one of the country's top health officials said that even with a much higher vaccination rate, the inoculation drive won't be enough for herd immunity. Dr. Sharon Elroy-Preez, the head of public health services in the health ministry, said, since there are 2.5 million children who cannot be vaccinated, we likely will not reach herd immunity, even if the entire rest of the population gets vaccinated. Children under the age of 16 were excluded from vaccine trials, and cannot be inoculated until further research is conducted. According to the data released Sunday, Israel's third lockdown has been the least effective one since the beginning of the pandemic. On Sunday, as Israel began to lift its third lockdown, which began in early January with 949 serious cases, hospitals were struggling to cope with 1,144 coronavirus patients in serious condition. If there had not been a third lockdown, even with partial participation, the situation would have been much worse. This is what worries me with the exit now, Elroy Preez added. The data also showed the rate of positive tests during each lockdown, with the first beginning with 3.7% and ending with just 1.7%. The second lockdown began with 9.4% and ended with 4.5%. The third lockdown, which began at 4.9%, ended with a positive test rate of 9.4%. According to Health Ministry figures Sunday, Israel recorded 2,625 new coronavirus infections on Saturday out of 28,852 tests performed. 1,144 patients were listed in serious condition, including 312 who were on ventilators. The death toll climbed to 5,096 as of Sunday morning, according to ministry figures. Elroy Preez said, "If we do not want to reach tens of thousands of cases and thousands in serious condition, the lockdown exit strategy must be careful, responsible, and slow." Israel's third nationwide lockdown to curb the spread of COVID-19 was eased on Sunday at 7 a.m. after over a month, yet there was no final agreement regarding the reopening of schools and kindergartens. This article was originally written by Toy staff for the Times of Israel on February 7, 2021. More than 97% of recent COVID deaths in Israel were people who weren't vaccinated, PM says. More than 97% of COVID-19 deaths in Israel over the past month were people who had not been vaccinated, Prime Minister Benjamin Netanyahu said on Tuesday, as his government tries to increase turnout for the Pfizer-incorporated shots. Around 38% of Israel's 9 million population have received at least one vaccine dose, the health ministry says. But government goals of achieving 50% coverage and reopening the economy next month have been challenged as the daily vaccination pace ebbs. "We are in a national emergency," Netanyahu told reporters. "I want to give you a jarring fact. Over the last month, the last 30 days 1,536 people have died of COVID-19 in the state of Israel. More than 97% of them had not been vaccinated. Fewer than 3% had been vaccinated." The vaccination drive began on December 19 with a focus on Israelis over the age of 60 and other high-risk groups. Israel has since lowered the eligible age to 16, but sees less urgency among younger citizens who are less prone to dangerous coronavirus complications. Israeli officials also believe some people are swayed by rumors of potential lasting side effects from the vaccines. Dismissing vaccine skepticism as fake news, Netanyahu added, "We are a vaccination nation. We have vaccines for every citizen, for everyone. If you go and get vaccinated, you are saving your lives." This article was originally written by Dan Williams, editing by Nick McFly on February 9, 2021.